Have you ever looked at the world and wondered why, with all our incredible medical breakthroughs, certain communities just seem to get stuck in the same health crises generation after generation? It's a really stubborn and frankly frustrating problem. Well, today we're going to dig into the work of Dr. Michele Battlefisher, who says that to even have a chance at fixing this, we first have to totally change how we see the problem itself. So let's get into it.
Right. This is the big question. What is going on here? Because it's not just about having more doctors or people making different choices. There's something deeper, something structural going on that keeps these patterns locked in. The research we're exploring today suggests the answer isn't a simple straight line. Instead, it's a huge tangled web, and we need to figure out how to start unraveling it. So, there's an official name for this: public health disparities. And as Dr. Battlefisher's work points out, this means there are very real, measurable differences in health that keep hitting marginalized groups the hardest. We're talking specifically about Black, Indigenous, and people of color, and also sexual and gender minority communities. And the key thing to get is that these aren't just random bad luck situations. They are literally baked into the systems we live in. So why is this such a stubborn problem to solve? I mean, think about it. Public health has had these amazing wins over the years, right? Like with sanitation or controlling infectious diseases. But when you look at health disparities, we just seem to be stuck. The progress isn't happening. And this quote from the research just hits the nail on the head. Our old methods are fantastic at one thing: proving the problem exists. We can measure it, we can chart it, we can show how bad it is. But what those tools can't do is help us understand the deep, messy structural reasons it keeps happening. So what does that mean? It means our toolkit is flawed. Let's talk about that flawed toolkit. You see, the very way most of us were trained to think about problems, well, it turns out that's actually a huge part of the problem here. It's an obstacle, getting in the way of a solution for something as complicated as health inequality. The old approach is called reductionism, and the basic idea is pretty simple. To understand something big and complex, you just break it down into its smallest parts. You look at each piece by itself, assuming that A causes B in a nice straight line. But you know what that's like? It's like trying to understand a massive citywide traffic jam by only studying the spark plugs in one car. You're completely missing the bigger picture. The other cars, the bad weather, the broken traffic lights, you're missing the entire system. And you can really see the difference laid out here. On one side, you've got that reductionist view. Everything's linear, predictable, made of separate little parts. But the real world, and especially a problem like health disparities, is so much more like the other side. It's a dynamic, interconnected, and often unpredictable system. You can't just pull one piece out and expect to get it. It's all connected. So if that old way of looking at things is broken, what's the alternative? Well, this is where the hero of our story comes in. It's a completely different and powerful way of seeing the world called systems thinking. Systems thinking basically flips reductionism right on its head. Forget the individual parts for a second. Instead, you focus on the connections, the relationships between all the parts. It's a way of looking for patterns and feedback loops, seeing how everything influences everything else. It's not about the car, it's about the traffic. It's about understanding the whole jam. So what exactly is a system anyway? Well, the legendary systems thinker Donella Meadows broke it down into three key things. First, you've got the elements. Those are the parts you can see, like people, hospitals, laws. Then you have the interconnections. Those are the rules and relationships that tie all those elements together. And finally, every system has a function or a purpose. And this part is absolutely critical. The true purpose of a system is what it does. It doesn't matter what the mission statement says. If our health system keeps producing inequality, then, well, that's its purpose. And boom, this image from Dr. Battlefisher's work says it all. This is what a public health problem actually looks like. It's not a neat little line. It is a sprawling, tangled web of social factors, policies, ethics, you name it. This is the kind of complexity that the old reductionist way of thinking just completely and utterly misses. Okay, so let's take this new superpower, this systems thinking lens, and point it directly at health. How does it change how we think about where health even comes from? It turns out the World Health Organization has a really fantastic framework that helps us see it. This model comes from the WHO, and the big takeaway is this: your health doesn't start when you walk into a clinic. It starts with the conditions of your daily life, and those conditions are shaped by the rules of the society you live in. Let's break down what that means. First up, you've got what are called structural determinants. I know, it's a bit of a mouthful, but just think of them as the rules of the game for our society. We're talking about the really big picture stuff. Our government, our economic policies, our social values. These are the powerful, often visible forces that create the pecking order. Who has power, who has advantages, and who doesn't. And those big rules of the game directly shape the next layer, the intermediary determinants. This is the stuff you can actually see and feel, the conditions of our lives. We're talking about your housing, your job, the food you can buy, the stress you're under. And here's the crucial link. These conditions aren't just random chance. They are a direct output of those bigger structural rules. See how it all connects?
So why is making this mental shift to systems thinking such a big deal? Because it's not just a fancy new way to describe the problem. It gives us a completely new playbook for how to solve it. It shines a big spotlight on where we actually need to put our energy. Dr. Battle Fisher's work points out 3 areas where we desperately need this new approach. We've got to start treating public health ethics and policy like the complex systems they are, not just a list of rules. And we need to do deep dives into the specific systems that are creating these bad outcomes for BIPOC and SGM communities. Think about the difference. The old way might build one new clinic. A systems approach asks, why don't we change the housing policies that made people sick enough to need that clinic in the first place? I just love this quote that's cited in the research. It asks, what if all this messiness and complexity isn't just getting in the way of a simple ethical answer? What if the mess is the ethical problem we have to deal with? It suggests that to make any real progress, we have to lean into that complexity, not try to wish it away.
And that really leaves us with one last massive question to think about. Health inequality is a systems problem. You know what else is? Climate change, economic instability. So many of our biggest, most tangled challenges are systems problems. So just imagine what we could accomplish if we finally stopped looking for easy, simple fixes and instead started to change the very way we see the systems themselves.